Welcome to the Plastic Surgery Playbook. I mean, imagine spending hours in the gym, pushing your body to its absolute limits, maybe even taking steroids to achieve this peak hypermasculinity, only for your biology to just,
To completely rebel.
right, to completely rebel and start growing female breast tissue. It is a massive physiological paradox.
It really is. And it actually happens to be driving one of the fastest growing sectors in medicine today, which is male cosmetic enhancement.
Exactly. We are looking at this booming, rapidly evolving landscape because for decades, the conversation around aesthetics was, almost entirely centered on women.
Right. But that old narrative is completely fracturing now.
And for you, the listener, whether you are personally considering tweaking a feature that has always bothered you, or you're just insanely curious about the shifting social dynamics happening in the workplace and on your screens, this analysis is your definitive guide to the modern male aesthetic.
We are definitely tossing out the old stigmas today.
Absolutely. So to map this out effectively, we are grounding our entire playbook in the clinical data and surgical insights of Dr. Shim Ching.
Right. He is a highly experienced board-certified plastic surgeon based in Honolulu, Hawaii.
But he also maintains active practices in Doha and Dubai, which is just wild.
It is. It gives him this incredible cross-section of global aesthetics. He isn't just seeing one specific demographic in one city.
He's observing what men want on a worldwide scale.
Exactly.
Yeah.
And you add to that his 26 years in the field and nearly 30,000 procedures.
That's a staggering number of procedures.
It is. And when a surgeon hits those kinds of numbers, they stop just seeing individual surgeries. They start seeing the macro trends. They really understand the deep underlying psychology driving the physical changes men are seeking.
Let's actually look at that psychology before we get into the literal nuts and bolts of the actual surgeries, because I have this analogy that keeps popping into my head.
Okay, let's hear it.
Looking at the modern approach to male cosmetic procedures, it feels very similar to maintaining a vintage classic car.
Oh, I like that.
Yeah, you aren't trying to chop the car in half and turn a 1960s Mustang into a modern hybrid, right? You aren't changing the fundamental identity of the vehicle.
Right. No one wants to look completely unrecognizable.
Exactly. You are simply polishing the exterior, buffing out the dents, and doing some targeted routine maintenance so that the powerful engine you feel revving on the inside actually matches the sleek paint job on the outside.
That vintage car framing perfectly captures the intent. Men generally are not looking for total transformations. They just want to look like refreshed, well-rested versions of themselves.
Which makes total sense. So what does the landscape actually look like right now?
Well, the clinical data we have from 2024 is staggering in this regard. Men now account for approximately 7% of all cosmetic procedures.
7% might sound like a small slice of the pie at first glance, but I imagine the growth rate is where the real story lives.
Oh, the growth is exponential. We have seen a 53% increase in male procedures over just the past decade.
Wow.
And an 88% increase over the last 10 to 15 years. We are talking about over 1.6 million non-surgical procedures for men in the U.S. in 2024 alone.
Over 1.5 million non-surgical tweaks in a single year. That tells me this isn't some fringe Hollywood trend anymore.
Not at all.
There has to be a massive environmental trigger pushing everyday guys into the clinic. I'd bet a lot of it comes down to screen time.
You hit the nail on the head. We actually call it the Zoom effect.
The Zoom effect, yeah.
Think about it. For generations, the average man looked in the mirror maybe twice a day, right? Once while shaving in the morning, once while brushing his teeth at night.
Just a fleeting glance.
Exactly. It was a fleeting glance. Now, men are staring at a high-definition, often really unflattering feed of their own face on a monitor for 6 to 8 hours a day during virtual meetings.
Yes. Oh, it's the worst. Next time you are on a virtual call, just check how your webcam lighting exaggerates the shadows under your eyes or highlights the asymmetry in your jawline. It is brutal.
It really is. You are essentially forced to study your own aging process in real time.
All while trying to present this professional, energetic front to your colleagues.
Right. Combine that daily visual scrutiny with intense professional pressure. In many corporate environments, there is a tangible, unspoken demand to look youthful, vital, and competitive.
So older men are feeling that pressure acutely.
Absolutely. Older men, particularly those in the 35 to 50 plus demographic, are feeling this heavily. That is why they're dominating the market for Botox and fillers right now.
Yeah.
They're using non-surgical rejuvenation to stay visually competitive.
What about the younger guys?
Meanwhile, younger men, the 18 to 34 demographic, They're leaning heavily into surgical interventions like liposuction and rhinoplasty to optimize their baseline appearance early on.
Which really signals the death of that ridiculous, outdated stigma. The old narrative was always, real men shouldn't care about their appearance.
Right, which is just nonsense.
It's incredibly toxic if you actually dissect it. It tells men they aren't allowed to take pride in their physical presentation or feel confident in their own skin. Tearing down that stigma is just objectively healthy.
I totally agree.
When a man takes ownership of his self-confidence, you see the positive impacts ripple outward into his social well-being and his overall mental health.
The psychological relief is palpable. When a man stops wasting mental energy worrying about a receding hairline or a tired appearance, he redirects that energy into his career, his relationships, his hobbies.
And we see this normalization everywhere in pop culture now. Celebrities are finally ditching the secrecy.
Right.
You have guys like Simon Cowell or Joe Jonas who've been very open about enjoying Botox, fillers, and other aesthetic maintenance. When guys in the public eye treat it as casually as going to the gym, it proves that utilizing these treatments is entirely mainstream.
Exactly. So if the non-surgical work is the routine oil change for our vintage car,
The surgical side is the actual bodywork.
yes, Dr. Ching outlined the top surgical procedures he performs on men, and dominating the list is body contouring. Specifically, liposuction, boasting over 21,000 male procedures in 2024.
I have to assume this is so popular because men are biologically cursed to store fat in the absolute most frustrating places.
Genetics dictate fat storage, and for men that means stubborn accumulation in the chest, the abdomen, and the flanks.
The areas we affectionately, or well, not so affectionately, call love handles.
Right, the love handles.
Right.
Dr. Ching points out that these specific pockets of fat are incredibly resistant to diet and exercise.
Yeah.
A man can be highly disciplined, run marathons, lift weights, and still carry a layer of fat around his midsection. His body is evolutionarily programmed to hold on to those specific reserves for a famine that never comes.
Right, so when crunching abs in the gym fails, the surgery physically steps in. But I want to understand the mechanics here. I think people picture a loud vacuum just indiscriminately sucking fat out.
Oh no, the actual procedure is a lot more sophisticated than that now, much more refined. Modern liposuction is a highly controlled sculpting process.
Okay, how does it work?
Dr. Ching utilizes a technique where the targeted area is first infused with the tumescent fluid.
What's in that?
It's a specialized medical solution containing saline, localized pain medication, and epinephrine. The epinephrine is key because it constricts the blood vessels to minimize bleeding and bruising.
Oh, that makes sense.
And this fluid causes the fat compartment to swell and become firm, essentially separating the fat cells from the surrounding muscle and connective tissue.
Oh. So it isolates the fat cells first, making them easier to target without damaging the surrounding structures. That is incredibly smart.
It is. Then, a thin, hollow tube called a cannula is inserted through incisions so small they often do not even require stitches.
Wow, really?
Yeah. The surgeon moves the cannula back and forth to gently break up those isolated fat cells, which are then suctioned out. It is designed to create a cleaner, much more athletic contour.
I do need to push back on the long-term reality of this, though.
Okay, here.
Let's say a guy gets his flanks sculpted. He looks great, but he doesn't change his underlying lifestyle. He is still eating fast food. He is slipping the gym. I've always heard that if you get liposuction and gain weight, the fat just magically finds a new, weird place to settle. Like, does his neck suddenly get huge because the stomach fat is gone?
That is a crucial physiological distinction that surgeons like Dr. Chang emphasize during consultations. Liposuction physically removes fat cells from the body.
Right.
Those specific cells do not grow back. The flank or abdomen will permanently have fewer fat cells.
But the remaining cells elsewhere can still swell up.
That is the core issue. If a patient consumes excess calories, the body still must store that surplus energy. Since the treated area has fewer cells to absorb the impact, the remaining fat cells in the untreated areas like the arms, the back, the thighs, they will expand to absorb the excess energy.
So the overall harmony gets thrown off.
Exactly. The contour of the treated flanks will still be relatively smaller than it would have been, but the overall aesthetic harmony of the body will suffer. Liposuction is an architectural enhancement. It is absolutely not a substitute for a healthy metabolic lifestyle.
Okay, so you still have to put premium fuel in the car to keep it running well. That tracks. But let's pivot from the bodywork to framing the face. A receding hairline or a thinning crown is basically the universal male anxiety.
It really is.
It is the one thing guys dread looking for in the mirror, and it happens to be the next major pillar in Dr. Ching's playbook.
Mm.
Hair restoration.
It affects an enormous percentage of the male population. And the psychological weight of hair loss is profound because it visibly signals aging.
Yeah.
But the fascinating part of modern hair restoration is the underlying biology that actually makes it permanent. Men experience male pattern baldness because the hair follicles on the top and front of the scalp are genetically sensitive to a hormone called DHT.
Right.
Over time, DHT causes those follicles to shrink and eventually stop producing hair.
But the hair on the back and sides of the head doesn't fall out. Like guys who are completely bald on top almost always still have that horseshoe shape of hair around the back.
And that is the key to the entire procedure. The hair follicles on the back and sides of the head are genetically immune to DHT. They are programmed to keep growing for a lifetime.
Okay.
Modern restoration, specifically a technique called follicular unit extraction, or FUE, takes advantage of this biological quirk.
I love a good mechanical metaphor, so let's try this. It is not like planting brand new seeds in barren soil.
Right.
It is more like relocating the toughest, drought-resistant trees from the dense forest in your backyard and planting them on your thinning front lawn. They keep their resilient traits even in the new location.
That is a phenomenal way to visualize it. Dr. Ching meticulously extracts these DHT-resistant follicles one by one from the back of the head.
One by one.
Yes, we are talking about micrografts containing just 1 to 4 hairs each. Then, he creates microscopic recipient sites in the thinning areas of the crown or hairline. The true artistry of the surgeon is angling each individual graft so that it perfectly matches the natural growth pattern and direction of the patient's original hair.
And the most mind-blowing detail from Dr. Ching's notes is that there are no visible linear scars. Older hair plugs used to leave a terrible horizontal scar across the back of the head, making it so obvious you had work done.
The older strip method absolutely left a telltale scar. But with modern FUE, the extraction sites are essentially tiny pinpricks that heal invisibly within days.
You don't look like a patchwork quilt.
Exactly. The downtime is remarkably short, typically 2 to 3 days before a patient can return to normal daily activities. As the transplanted follicles settle and grow, it simply restores the patient to their natural baseline. If a man still has some native hair in the thinning areas, Dr. Ching can often intersperse the grafts so seamlessly that it looks as though the patient never lost a single strand.
It's incredible how hair restoration is all about rebuilding the frame of the face. But if we go back to that zoom effect we discussed earlier, the frame doesn't matter much if the focal point, the eyes, looks completely exhausted.
Absolutely.
Constant on-screen scrutiny means you are constantly staring at your own tired eyes. It is no surprise that this visual fatigue is driving a massive spike in the next major area of focus for men, which is blepharoplasty or eyelid surgery.
The eyes are the very first thing people notice, and unfortunately, they are also one of the first areas to visibly age. As a man progresses through his 30s, 40s, and 50s, the delicate skin around the eyes loses elasticity. Concurrently, the small muscles supporting the eyelids weaken.
And that creates the drooping effect on the top lid. But what causes the heavy bags underneath? Is that just a lack of sleep and too much coffee?
Sleep plays a role in temporary puffiness, sure, but chronic heavy bags are actually structural. We all have orbital fat pads that cushion our eyeballs within the skull. As those supporting tissues weaken with age, that protective fat literally bulges forward, creating permanent bags under the eyes and a heavy, hooded appearance on the upper lids.
So you end up looking perpetually tired, angry, or older than you actually feel simply because gravity and tissue laxity are pushing fat into the wrong place?
That is the physical reality. Blepharoplasty physically corrects this architecture. Dr. Ching makes incredibly precise incisions, often hidden in the natural crease of the upper eyelid or just below the lash line on the lower lid, to remove or reposition that bulging fat. He also trims away the excess sagging skin.
I look at eyelid surgery like changing a dim, flickering, incandescent light bulb in a room to a bright, crisp LED. You haven't bought new furniture, you haven't changed the layout of the room, but suddenly the entire space looks newer, more energetic, and awake. You are just letting the light back in.
The LED analogy perfectly illustrates the outcome. The surgery brightens the eyes and opens the face without altering the fundamental bone structure or identity of the patient.
Which is the goal.
Right. Dr. Ching notes that he very commonly performs this on both the upper and lower eyelids simultaneously. Addressing both creates the most cohesive, harmonious result. The downtime is about 1 to 2 weeks, but the payoff is arguably the most powerful, subtle way a man can revitalize his appearance.
While eyelid surgery clearly addresses the inevitable realities of aging, I want to take our time with the final major focus area of this playbook. We are pivoting from fighting the clock to addressing a deeply rooted source of physical insecurity. If you have ever felt that specific quiet panic of having to take your shirt off at the beach or avoiding the locker room at the gym, this is for you. We are talking about gynecomastia surgery.
Yes, gynecomastia is the medical term for the presence of undesired, female-like breast tissue in men. It is far more common than society acknowledges. In 2024 alone, there were over 26,000 of these procedures performed.
Over 26,000. That is a massive number for a condition that guys rarely talk about out loud. What is the actual biological trigger for this?
Well, Dr. Ching explains that the vast majority of cases are categorized as idiopathic. In medical terms, that simply means there is no clear underlying disease or identifiable trigger.
Okay.
Most men who experience this are born with a genetic predisposition. They experience a hormone fluctuation during puberty, and the tissue develops and stays.
Basically, a bad roll of the genetic dice.
Exactly.
Yeah.
However, there is a secondary cause that Dr. Ching highlighted in his notes, and this is the one that blows my mind. Steroid use.
I brought this up at the very beginning of our analysis. Guys are taking steroids to look as hypermasculine as possible. I thought testosterone just built muscle mass. How does putting an excess of male hormone into your body result in female breast tissue? That seems biologically backward.
It does seem contradictory until you look at how the body attempts to maintain chemical homeostasis. Steroids are essentially highly potent, synthetic versions of testosterone. Men inject or ingest them to push their muscle synthesis far beyond natural limits.
Right.
However, the human body has a strict threshold. It can only utilize so much testosterone at one time.
So the body hits a saturation point. What happens to the overflow?
The body initiates a process called aromatization. It takes that excess, unutilized testosterone circulating in the bloodstream and chemically converts it into female hormones, specifically estrogen.
Wow.
And that flood of newly synthesized estrogen then travels to the chest and stimulates the dormant glandular tissue, causing it to grow.
The bitter irony is just astounding. A guy is desperately trying to build this massive masculine physique, and his own biology panics, converts the fuel into estrogen, and gives him female characteristics. And from what I understand, once that tissue grows, you cannot just bench press it away.
No, it is a one-way street. Once that glandular tissue is stimulated and hypertrophies, it becomes firm, dense, and permanent. It does not shrink or vanish when the patient stops taking the steroids. It requires a highly specific surgical intervention.
Dr. Ching was incredibly detailed about the mechanics of this fix. It is not just a matter of going in with a cannula and doing standard liposuction.
Standard liposuction alone will fail because gynecomastia typically involves two distinct components:
Right.
regular adipose fat and the dense glandular tissue.
So how do you get both out?
Well, the fat can certainly be removed via liposuction, which Dr. Ching typically performs through a tiny, discrete incision hidden high up in the armpit. The tumescent fluid and cannula handle the fat. But the glandular tissue is too hard and fibrous to be suctioned out. It must be surgically excised, meaning the surgeon has to use a scalpel to physically cut it out and remove it through an incision.
And this is where the surgical art really comes into play, because the margin for error sounds terrifying. Dr. Ching issued a very specific warning about the excision process, right?
He did. He noted that surgeons must leave just enough tissue behind directly under the areola. If a surgeon gets overzealous and takes out 100% of that glandular tissue, the areola loses its underlying support structure and actually caves in.
Ouch.
Yeah, it creates a noticeable depression, like a crater on the chest.
It creates a classic contour irregularity. Removing all the tissue flips the problem from having unnatural fullness to having a visible, unnatural dip that clearly looks operated on.
Exactly. The skill of a top-tier surgeon lies in removing exactly the right volume of gland to create a flat, natural masculine contour while preserving enough structural padding to prevent a collapse.
He also has a very specific philosophy on scar placement. He completely avoids making incisions under the areola because those tend to stretch and leave noticeable white scars, which is especially visible on men with slightly darker or olive skin tones.
This detail is crucial for listeners considering the procedure. Dr. Ching prefers to make the surgical incision inside the pigmented area of the areola, right next to the nipple. By utilizing the natural color transition and texture of the skin there and pairing it with that tiny armpit incision for the liposuction phase, he achieves a truly scarless aesthetic result.
The attention to the micro details is just wild. You pair that surgical precision with a downtime of only 1 to 2 weeks, and it really shows how refined this playbook has become.
The refinement translates into life-changing results. The psychological relief these men experience is profound. They get their confidence back. They take their shirts off at the beach. They wear fitted clothing without hunching their shoulders to hide their chests. It is an incredibly rewarding procedure for a surgeon to perform.
So, synthesizing everything we have unpacked today, we are looking at a reality where male plastic surgery is simply no longer a taboo secret whispered about behind closed doors.
Not at all.
The data proves men are actively taking control of their aesthetic timelines. Whether it is liposuction, clearing away stubborn, genetically programmed fat, hair transplants relocating resilient follicles without leaving a scar, eyelid lifts fighting the inevitable Zoom fatigue, or gynecomastia corrections giving men their physical freedom back. This is all aided by highly skilled professionals like Dr. Ching, who deeply understand the unique anatomy, the complex biological mechanisms, and the psychology of the male patient.
As we close out our analysis, I want to leave you with a final thought to mull over.
Lay it on me.
We are watching these cosmetic enhancements become as routine and destigmatized for men as hitting the gym, optimizing their protein intake, or going to the barber for a premium haircut. As this technology becomes even more accessible, how will it shift our fundamental definition of what it means to age gracefully?
That is a wild, paradigm-shifting thought.
Right. Will future generations look back at the concept of natural aging not as an inevitable biological reality that we all must passively suffer through, but simply as an outdated choice?
It really makes you evaluate your own timeline. If the tools and the mechanics are readily available to keep the vintage car looking showroom ready, why would you choose to let it rust in the driveway? Thank you for joining us today to unpack the playbook. We'll see you next time.